Company 9, respond for a burn patient, Rockbridge GCC 1535.
Please respond. Please respond. Good, request air medical.
10-493 responding, 1536, 1536.
Is 103%.
Air medical has been notified.
Switches
Rockbridge
are in
GCC
flight. Gates closed.
1536.
Doors. My door secured. Unsecured. Good. Seatbelts and equipment. Harness secured. Unsecured. Everybody ready for takeoff? Ready. Ready. All right. We're clear of obstacles. We're on the go.
Carilion Clinic Lifeguard began as the first air medical program in Virginia in 1981. Since that time, the program has grown from a single aircraft in Roanoke to what we have today, 3 helicopters strategically placed in rural communities throughout Southwest Virginia, serving the bordering states and even beyond when we are the closest available helicopter. Lifeguard 10 is based in Hardy at Smith Mountain Lake. Lifeguard 11 is based in Radford at Carilion New River Valley Medical Center. And Lifeguard 12 is based in Lexington at Carilion Rockbridge Community Hospital. We generally fly within 60 miles of each of those bases for scene responses, as requested by public safety personnel, and about 150 miles for hospital transfers, as requested by the sending physician. Each helicopter is staffed with an instrument-rated pilot and a critical care flight paramedic and nurse. We fly about 1,500 patients per year, each of those flights dispatched and monitored by specialty-trained flight followers from our state-of-the-art communications center in Roanoke. We are also supported by multiple aviation maintenance technicians between the 3 bases. So while it may look quite different from the way it was back when we started in 1981, the heart of our people and our mission is the same today as it was 40 years ago, simply to provide safe transportation for the critically ill and injured for the communities we serve.
So we fly EC-135 aircraft, twin engines, capable of flying anywhere from 120 to 140 knots indicated airspeed, which equates to about 150 miles an hour. The benefit of flying a helicopter in the EMS environment is that we can navigate point to point, from point A to point B, without worrying about the winding highways and byways, or worrying about traffic and getting stuck in traffic. We have an autopilot aboard the aircraft that minimizes the pilot's workload, especially in marginal weather and in instrument conditions. What we can monitor in flight is the weather. We have an onboard weather radar that, as you can see, is indicating some clouds and some precipitation in the foreground. And the pilot also has the ability to look at the weather updated on his iPad that he carries with him in flight. In addition to the onboard weather radar, we have a TCAS, which monitors the airspace around the aircraft and allows us to pick up any aircraft that are within a 50-mile radius that have a transponder on board. It's good for traffic awareness. Additionally, we have HTAWS, which provides not only an audible but a visual warning in the event of terrain.
Warning, terrain, terrain, warning.
The aircraft is equipped with redundant navigation systems as well. We can navigate on either our primary GPS or our secondary GPS. Both provide the exact same information. One is just a smaller screen. This provides us in VFR and IFR capabilities. At night, we fly with the night vision goggles, but an additional safety features, we have an articulating searchlight, which we activate via the collective control, and we can move that searchlight to illuminate the entire LZ. As we get in closer, we also have the additional scene lights, utility lights that are mounted on the aft skid that provide additional illumination into the LZ and also gives the crew, once we're on the ground, additional illumination for the loading and unloading of patients. Beneficial to the pilot and the crew is the LZ commander to not only describe the landing zone, but also to park his apparatus under any known wires. That allows the pilot and the crew to find them much easier at night. It's always important for the LZ commander to provide us an alert to any obstacles, and wires, whether it's day or night, are always of a concern. In the unlikely event that we encounter any wires that are unreported, the aircraft is equipped with a wire strike prevention system.
Patients who benefit from air medical transport include those with time-sensitive needs, those requiring advanced critical care, or both. On scene responses, our Lifeguard helicopters transport patients to the closest appropriate facility. Central to our operational area is Carilion Roanoke Memorial Hospital. This is Western Virginia's only adult and children's Level 1 trauma center. We also have a primary stroke center with 24/7 neurointerventional capabilities and a fully accredited 24/7 cardiac cath lab and chest pain center. In addition to these medical and trauma emergencies, the Lifeguard team also has access to a specialized transport team from Carilion Children's neonatal and pediatric intensive care units. When determining if a helicopter is needed, it is important to consider what specialty skills and equipment the flight crew can bring to the scene or hospital. Our critical care flight crews are capable of performing advanced skills and treatments, such as rapid sequence intubation, mechanical ventilation, non-invasive ventilation, blood product administration, advanced hemodynamic monitoring, portable ultrasound, and balloon pump. We have a comprehensive inventory of medications at our disposal as well. In order to avoid patient transport delays, the helicopter should be requested as soon as possible, using an auto-launch system based on feedback from your agency's medical protocols. Each of the Lifeguard helicopters can fly up to 2 patients, though it is generally best practice to transport only 1 per helicopter so that optimal patient care can be given by the flight nurse and paramedic.
Once it is decided that Lifeguard is needed, the only information we need to start our response is the patient's location and the nature of the call. We will also need to know if it is a go or a standby request. We will then give your dispatcher the option to either wait on a brief hold or receive a call back once our pilot has checked the weather. If the pilot accepts the flight, we will obtain some additional information. Whenever possible, please provide us with an estimated patient weight. For scene responses, we will need the latitude and longitude coordinates, or we can use the incident address to obtain the coordinates. Other information needed for scene calls includes details about the LZ, the radio frequency, ground contact, and any other important patient information. Please provide a cell phone number for the LZ commander, which allows us to have an alternate contact method if radio communications are not usable. For hospital transfers, we will need the type of patient and the location in the hospital. Additional medical information will be obtained as needed. Please let us know if any other flight program has declined your request for a helicopter so that we can pass this information to our pilot for consideration. If our primary aircraft for your region is unavailable for a scene standby request, we will let you know that we can lift our secondary aircraft to head in that direction until you stand us down or advise us that it is a go. We will let you know if the pilot is unable to accept your flight request, and depending on the reason for the turn down, we will ask if you'd like us to help find another helicopter that may be able to assist you. If we are unable to accept a hospital transfer flight request, we will ask if you need critical care ground transport. That decision will ultimately need to be made by the patient's sending physician, with an understanding of ground transport ETA to your facility versus the closest available ALS unit. We want to help you do whatever is most appropriate for that patient.
Of course, we do check the weather throughout the day, but when the comm center calls with a request, we'll take a closer look at the weather for that requested route. Many times we can give the answer to the comm center immediately, but sometimes weather will require us to take a little deeper look.
Lifeguard 12, I have a weather check for a scene response, Rockbridge County. Lifeguard 12, weather check for a scene response, Rockbridge County at 1540.
Lifeguard 12, correct, checking weather.
Copy, Lifeguard 12, checking weather, 1540.
We can't fly in icing or thunderstorms or fog, but we do ask that you make your request and allow the pilot to make that weather decision.
From the moment the pilot accepts the flight follower's attention is focused completely on the aircraft. Once the crew lifts, we are monitoring them in real time through our satellite tracking system. We primarily talk to them on the radio, but we also have the capability of contacting them via satellite phone in the aircraft. So if there are any updates regarding your LZ or patient, you can call us back and we will relay the information to the flight crew.
When we call for Lifeguard, we know that we are managing more than one priority. Not only are we attending to the patient, but we are also assigning a crew to set up the LZ. The landing zone commander can be anyone from the fire department, the rescue squad, or even law enforcement. The LZ commander will find an area that is the appropriate size, at least 100 by 100 during the day and somewhat bigger at night, that is clear of all obstructions such as people, vehicles, trees, poles, and wires. We often use pre-designated LZs, but we also often try to find an appropriate LZ that is closest to the scene. One of the things that we have found works best is to have 3 vehicles set up in a triangular formation, about 150 feet or about 60 paces apart. While we are setting up the LZ, we are always monitoring for the radio call from Lifeguard. We then give them a first-hand account of the LZ via the radio that includes information about the size, slope, surface, obstacles, and winds at the landing zone.
When setting up a safe LZ, we need to know about power and telephone lines, not only around the perimeter of the LZ, but also any that would affect our approach or departure. Wires can be very hard for us to see day or night. We usually look for poles to alert us that there may be wires, but we depend heavily on the LZ commander to check as well. Something else for you to ensure is that the slope of the LZ is as flat as possible. Since we are using night vision goggles, it is important to make sure that no white lights are used to illuminate the LZ and that ambulances are nosed into the LZ. This way, when the patient compartment doors open, the bright white lights will not impact the pilot. Keep in mind that it is important to not just look at the surface of the LZ, but also to check the air above the LZ, specifically for drones. Try to locate the drone operator and ensure that they land the drone and keep it on the ground until the helicopter is completely out of sight. If you would like us to land on a road, please position fire apparatus on the roadway from each direction so that the LZ is closed to traffic from all sides. This should also be done on a 4-lane highway while the lanes opposite the median remain open.
Even though we have coordinates of your landing zone, it can sometimes be difficult to visualize the LZ from the air. If there are any easy-to-see landmarks or identifiers around the LZ, this can be helpful information. When your LZ is set up near an incident that also has a lot of apparatus dedicated to the scene, it can be hard to tell which location is the LZ. In this case, please also relay any information that can help us identify the correct area. Let us know via radio when you are first able to see us. We may ask what your position is relative to the helicopter. For example, if the helicopter is flying straight towards the LZ, say, the LZ is at your 12 o'clock position. Once we land, do not approach the aircraft on your own. We will assign someone to be our tail rotor guard to make sure that no one approaches the aircraft while it is running. In most cases, our pilot will remain with the running aircraft while the medical crew comes to assist you in assessing and treating your patient.
While our LZ commander is setting up the landing zone, we are usually busy getting the patient ready, whether that is during the extrication process or additional procedures in the back of the ambulance. We try to do everything we can to have the patient ready for transfer to save valuable time. For example, starting an IV, obtaining an EKG, or applying a traction splint, just to name a few. We also try to get a thorough screening for infectious disease so that the flight crew has an opportunity to don the appropriate PPE before they climb into the back of our unit. Additionally, we screen for hazmat exposure, knowing that unless the patient is fully deconned, he or she will not be able to fly. As time permits, we try to write down some important handoff information such as patient demographics and a summary of treatments for the flight crew to take with them.
Just like EMS crews when preparing patients for an inter-hospital transfer, we do everything we can to make sure there's no delays on our end. We ensure the patient, equipment, and paperwork are all ready to go. Having Lifeguard available as an extension of their specialty centers is a real benefit to patients and their families. Whether it's cardiac, stroke, trauma, OB, medical, pediatric, or even neonate patients, we know they've got us covered.
The flight crew may ask you to assist with maneuvering the stretcher to the aircraft. If so, we will give you specific instructions on how to assist. Only handle the stretcher in the safe areas identified. Remove any loose articles of clothing such as hats prior to approaching the aircraft. Please allow the flight crew to operate the helicopter doors and lift the stretcher into the aircraft. Stay away from the tail rotor and exhaust in the rear of the aircraft and the pitot tubes, which can be very hot, at the front of the aircraft. After we have loaded the patient, we will begin to secure the doors of the helicopter. At this point, the flight crew will direct you away from the aircraft. We will also ask that the LZ commander or hospital security officer continue to monitor the radio throughout our departure so they can advise us of any new hazards if identified. Keeping the radio channel open is also important in case we experience an emergency, in which case we may need to return to your LZ. Once we have departed the area, we will advise you via radio that we are clear of the landing zone. If you provide us with your contact info, we may be able to provide you with an update on the patient after we have arrived safely at the receiving facility and transferred patient care. We may also reach out to the patient's family if you were able to obtain their contact information for us.
There are some special circumstances to be aware of. While we generally do not transport patients in active labor, we always will respond to you, weather permitting, to evaluate the patient. After assessment, we can work with you to make the decision whether it's best to fly or to transport by ground. We also have the option to request our neonatal pediatric transport team to meet us at the requesting facility, scene, or rendezvous with us if transporting the patient by ground. For patients in cardiac arrest, we will be happy to fly to the scene and work with you to determine what is best for that patient, which may include joining you for ground transport in the back of the ambulance to a hospital. Burn patients generally require transport to a burn center. When you advise us of the need for the transport of the burn patient, our pilot will do a weather check to the nearest burn center and ensure that we have the fuel needed to make the flight. As a reminder, do not hesitate to launch us early. If we are not needed, you can stand us down. We would rather wait at the LZ for you than you wait for us at the LZ. Lastly, there is always a possibility of an emergency landing with any aircraft. We count on you to be able to respond appropriately. Therefore, we offer special training for emergency landings called HEAT, Helicopter Emergency Accident Training. This is in addition to our standard LZ classes. We also have several disease-specific classes and scenario-based training in our Simbulance that we can provide for your hospital or EMS agency. If you would like to set up any of these training classes, please email us at lifeguard@carillionclinic.org. You can also email us to request patient follow-up for quality assurance and educational purposes. Thank you for your hard work serving our communities, and thank you for entrusting us with the care of your patients.